first thing you have to do is you have to put in you have to change the system from a disease system to a wellness system. Right now, we wait till people get sick and then we pay billions of dollars, Dave, to get them well. If you have a car, you change oil and grease, preventative maintenance. And so you're going to have to make sure you go into a wellness and prevention program and change it from a disease system to a wellness system. The second thing you got to do is you've got to be able to do something about chronic illnesses. You've got to be able to...
Before you go there, how do you change incentives so that you get from fee to service, which is, I think, part of what you're talking about, to a different approach for...
You got to change the whole concept, because I'll get to that if you give me a little time to develop it. So then you got to do something about chronic illnesses, and this is where the incentives are going to come in. You're going to have some incentives for companies to be able to make sure that their employees that they cover by insurance are able to be tested and able to use wellness and prevention to keep well in the first place. And it's going to be, and a lot of companies are doing it already on their own. And there needs to be some kind of inducements to make sure that we're able to make sure that people eat properly. But it's going to be more of an education thing than telling people what they have to eat. It's going to be more of an education thing, and you're going to have an opportunity for wellness to keep people well in the first place. And then what you're going to have to do is you're going to have to change the system from one that's based upon quality. I started this when I was secretary, based upon hospitals depending upon quality, and also nursing homes. And so if you get sicker or have a new disease or infection while you're in the hospital or nursing home, that has got to be a responsibility of the nursing home or the hospital there. And that's the quality, and you're going to have to figure out a way to get paid more for quality. The fourth thing you're going to have to do is you're going to have to change the way we pay for doctors, because right now doctors have to generate fees by procedures. It's a wrong-headed way. So you've got to be able to holistically bundle the payments or have holistic approaches to be able to have doctors be able to do it. The fifth thing you have to do is, if you're ugly going into the hospital, more than likely you'll be ugly coming out. And you shouldn't be able to sue because you're not beautiful, right? So you've got to be able to change the system so doctors do not spend so much time trying for practice defensive medicine. You've got to be able to set up some sort of arbitration type of thing so doctors are able to do it.
So what's the government's role in trying to change those incentives, though, from fee for service to that more holistic sort of look at it?
The government's going to have to do that. It's going to have to be very much involved, but it's going to have to be in concert with hospitals and doctors.